Dr. Robert Rosenberg with us chatting in the studio right now. He is the director, the medical director of the Sleep Disorder Center in Prescott Valley. Since we saw you last, you have become board certified in sleep medicine, I understand.
That is correct.
Sleep medicine, a whole new branch of medicine, I would imagine. We don't often hear about that. Remember the prayer, now I lay me down to sleep.
I pray the Lord my soul to keep.
If I should be okay. So many people find it quite easy to go to sleep. Other people don't.
Correct.
Insomnia rules their life.
10% of people in this country suffer from chronic insomnia.
Oh, wow.
How do you define chronic?
Over a month, inability to sleep at least 4 days a week.
Then it becomes chronic?
Well, that's how we define it, as being chronic. If it lasts a month, there's transient insomnia, which may just be a few days in response to a death in the family, or something like that. That's normal. But if it goes on for a month, and you're still having difficulty either falling asleep, staying asleep, or early morning awakenings, and if it results in inability to think, irritability, memory problems, those are the consequences to the insomnia, that would be the definition of chronic insomnia.
Yeah, it's really a serious health issue, insomnia, which a lot of people say, oh, I didn't get a good night's sleep. But over and over again, this really becomes a physical problem as well.
Well, we know that people with insomnia have an increased incidence of heart attack and stroke, something like sleep-disordered breathing. They certainly have an increased incidence of mental problems, psychiatric problems.
Really?
Yeah. We used to think that depression resulted in insomnia, and we used to call that a secondary form of insomnia. But now we know in many cases the insomnia precedes the depression, and we now no longer refer to it as a secondary disease but a comorbid, because they are independent spheres. And if you don't treat the insomnia, the majority of depressive patients will relapse.
Wow. Now, also accidents in their everyday life or in the workplace.
Yeah, because absolutely, it's one of the consequences of insomnia, the inability to work, increased incidence of accidents, increased hospitalizations. People with insomnia consume many billions of dollars in healthcare costs as a result of the insomnia being untreated.
And they start popping a lot of pills.
And they start taking pills, and they start taking over-the-counter medications, most of which don't work very long.
It's a pill to wake up, and then a pill to put them to sleep.
Exactly right.
To wake up.
And consuming coffee, and they develop very poor sleep habits and what we call sleep hygiene in response to the insomnia, most of which makes the insomnia worse.
And then it's a vicious circle for folks. Do people try too hard to go to sleep?
That's a great point. That's exactly what they do. People develop this, I'm going to make myself fall asleep, or I'm going to stay in bed for 9 hours tonight, and that makes matters worse. Actually, what happens is their sleep efficiency, or the percentage of time they sleep per total time, becomes less and less. Also, if you say to yourself, I'm going to make myself fall asleep, that will cause anxiety. If we do an electroencephalogram, we see brain waves go into an awake state, and then you can't sleep, and your body becomes tense.
Is there such a thing, I've heard this in the past, sleep cycles, that when you do sleep too long, then you go into another sleep cycle, and the sleep cycles get all messed up, then obviously you're out of whack. You can't sleep.
That's what happens, is you start to ruin your own circadian cycle. In other words, most of us have a clock in the part of the brain called the suprachiasmatic nucleus, and there's little clock genes that actually tell us about 11 o'clock, average American gets sleepy and wake up about 7 o'clock in the morning. If you start trying to compensate for your insomnia by either getting to bed earlier, staying in bed longer, you start to alter that circadian cycle.
But if you're sleepy, you can go to bed earlier.
If you should, and what we teach people...
Because that's your clock.
Right, absolutely correct.
Okay.
But if you start to develop bad habits in response to your insomnia, forcing yourself to go to sleep earlier than you normally would, or trying to stay in bed later than your circadian cycle tells you should, that's when the problems begin.
What about a guy like me who likes to go to sleep about 2 o'clock in the afternoon at the desk? Is that detrimental?
Only if you're an insomniac. If you have insomnia and you nap, you're going to be robbing your sleep time. It's what we call homeostatic pressure. Okay, really there are two things that run your sleep: circadian phase and homeostatic pressure, which builds up the longer you're awake. So if you have insomnia and you tend to nap during the day, you've just robbed yourself probably of the hour of sleep that you're not getting at night.
So there's help. You're telling us, as we're listening here,
of course,
there are ways to help this.
Absolutely.
And cure it.
And, well, yes, in most cases you can. If people are willing to work with us, for instance, at our center we have a nurse practitioner, myself. We work we try to avoid medication if possible. Now, that's not to say that you can't use medication, but we try to use what's called cognitive behavioral therapy. Try to restructure how people look at their insomnia, get them into good sleep hygiene, not taking naps, not drinking coffee, and that's how we begin to treat them.
So you probably do an extensive study of their habits.
Very much so.
Of what they're doing on a daily basis?
Before they ever see me, they fill out a week or two of sleep logs. What time I went to bed, what time I woke up, how many times I got up during the night, how many hours do I think I slept, how many cups of coffee did I have, did I drink alcohol, the whole thing. Then we also have them fill out a thing called a Beck Depression Inventory. We want to see if maybe they do have depression. We have them fill out an anxiety scale. We have them fill out a fatigue scale. So when they first come to see us, we have a pretty good idea of whether or not there are other factors involved in their insomnia. And then after that, it's about an hour interview.
Restless leg syndrome.
Excellent.
Becoming very popular. I mean, you hear it on TV all the time.
Restless leg syndrome is a contributing factor to many insomniacs. I have any number of patients who come to me. I had an elderly gentleman recently who hasn't slept well in 20 years, but nobody ever bothered to ask him, what about your legs? All he did is he tells me he gets up and marches around the bedroom all night long. This has been going on, his wife said to me in a very heavy Spanish accent, they're lovely people, that this has been going on for 20 years.
Because the legs want to move.
He cannot stop walking because when he does stop, the pain comes back, and that's how you define restless leg syndrome. It's an irresistible urge to move in response to pain of various types. Some people describe pins and needles, some people describe shooting pains, but the one thing they all tell me is, when I'm moving, the pain goes away, and when I stop moving, the pain comes back.
Do you know what helps that? Because I tend to have that.
Oh, many things help it. First of all, if you don't want to...
A hot bath at night before you go to bed.
Yes, it can. And rubbing your legs can help.
Yes.
And avoiding caffeine can help. And then in some cases, like this elderly gentleman, you really have to go with medication. And also, we check iron levels. A lot of people with restless leg syndrome have low iron. Very common. And we check iron, and in some patients, when I replenish their iron, we're able to take them off of the medication for restless leg.
My iron kind of flip-flops.
Is there something physically, as Tanya said, she doesn't have problems sleeping. I certainly don't have problems sleeping. Is there something in our systems or in our chemistry that allows us to do that, even though we may have the same kind of stress in our life?
Well, you folks are normal. But what we
that's debatable.
What we found is that in the 3 Ps, predisposing, precipitating, and perpetuating, we found that in the predisposing, why does somebody get insomnia? Well, many people have a high metabolic rate. Their temperature actually runs higher at night. Their basal metabolic rate is higher. We check their urinary catecholamines, which are stress hormones. They're high. Then we have other people who are just ruminators. Some people are worrywarts. They take everything to bed with them. They plan in bed. They eat in bed. They watch TV in bed. They just plan out the day. You know, you should not do that. And then some people have restless leg or sleep apnea or circadian problems. So there's a whole host of causes why would one person have insomnia and another one wouldn't.
If you're lying there and you can't get to sleep and you're thinking about something, I have found that, and maybe you treat this also, if you get up and write those things down, then you can go back to bed and sleep.
What we train people to do, one of the cognitive theories in worriers, we say, why don't you take 3 hours before bedtime, write out all the plans for the day, all the problems, everything, and then the solutions, and don't take them to bed with you.
Right.
Now, if you get into bed, on the other hand, and you're worrying, I would rather than what you do, I would rather they go into another room, if they can't sleep after 20 minutes, and do something quiet. We even have little sewing, writing a letter, not their problem.
Should they exercise? I know my wife tries to exercise.
No, not at night.
No.
Never exercise if you have insomnia.
So maybe
4 hours, no closer than 4 hours to bed, because it raises the body temperature, and if you have insomnia, now this is only for people, that may make the insomnia worse.
Interesting. Stay right there.
Great information. Great information.
Very good information. When we come back, more about sleep disorders and insomnia. If you have insomnia, we have a few answers for you. Don't go away.
All the way back to the year 1959. Somewhere
I'm getting fairly sleepy right now. Actually, I'm very fortunate. I sleep very well. Tanya's mentioned she sleeps very well, but many of you do not sleep well, and that's why we have Dr. Robert Rosenberg with us. And Doctor, great information. First segment, I hope we had everybody staying with us. You know, talking at the break, Is it normal to get up maybe once a night? If you get up once a night, you think, man, I have a sleep disorder, but that's normal?
That is normal. You might be getting up to urinate, you might be getting up for any, but the problem is if you get up and you can't get back to sleep, then it's a problem. And as we get older, our sleep becomes much lighter. We don't have as much deep sleep, or what we call delta sleep. So after you get into your 40s and 50s, your deep sleep, unlike when you were a young man or a young woman, may drop as much as 30 or 40%. So you tend to have more arousals during the night. The key is, when you have these arousals, can you go right back to sleep, or do you end up not being able to fall asleep and staring at the ceiling for an hour or two? That's when you develop insomnia.
Can we make a blanket statement of 7 to 9 hours? Is that the range? I've heard, you hear various ones.
You know, that's funny. I did a thing for Newsweek about 4 months ago that appeared, how much sleep do you really need? And in researching it, 7 to 8 hours is really the majority, but it's a bell-shaped curve. Some people only need 6 hours, and some people, what we call long sleepers, need 10 or 11 hours. The problem we have is that some people with insomnia develop what we call dysfunctional beliefs about sleep. I must sleep 8 hours.
Yeah.
So they stay in the bed 8 hours even though they're only sleeping 5 or 6.
I've known people, especially younger, when I was younger, that said, you know what, I get up at noon because I need a lot of sleep. So they were sleeping like 11, 12, 13 hours.
And they're long sleepers. Now,
is that bad for them?
Well, not. There are some studies that show if you get into the 10 or 11, mortality studies actually show, just like the 4 to 5 hours, you begin to see an increase in death rates from various causes. But it hasn't been proven, but at least there are some studies that seem to show too little sleep in the age of 4 to 5 hours is abnormal, is bad for you, and too much sleep may be abnormal. But we do have people who are what called long sleepers, and they do just fine.
So it does depend on the body and each individual,
Of course it does, of course.
Now that's what I was referring to, not necessarily insomniacs, but people who aren't, but going into their next sleep cycle. Sometimes you can't, and then you're groggy. You get up and you're just...
Right,
can't quite wake up.
That's called sleep inertia or sleep drunkenness. And a lot of times what that is as you were about to wake up or towards the early morning hours, you go back into what's called delta sleep, which normally occurs during the early part of the night. And it's very hard to recover from deep delta sleep. And remember, if you take a nap too long, we advise people who with narcolepsy, take only half-hour naps. If you nap 45 minutes to an hour, you may have a hard time recovering because you go into deep sleep.
Now, people that sleep a long time, and I remember a few of my friends, they seem depressed when they were sleeping deeper. Does that have any relationship with depression at all?
It may, because not only is depression characterized by insomnia, but there is a proportion of people with depression who need to stay in bed and sleep longer. And that can be a symptom of depression as well. So that may have been the case in the people you were talking about.
Now, how does it work at the center? Do you have people come there and sleep? I don't like to sleep away from home, so I might not be a good candidate for you.
If you come to us for insomnia, we're probably not going to just right away do a sleep study on you. I don't think that's appropriate. If you come to us in insomnia, we keep working with you, and we still have a problem. You know, maybe we're missing something. Then we might. It's amazing what we find. We find sleep apnea. Sometimes we find seizure disorders in people that they were unaware of. Okay, we find all kinds of things. And if
seizures? You have a seizure in the night?
Oh yeah.
People do?
Oh sure.
Normally?
No, not normally, but yes, it's not. People with there are 10 to 15% of people with seizure disorders have them in their sleep only.
Wow.
Well, is this it sounds like a dangerous thing.
Well, it is, and it interrupts their sleep, and sometimes they have what we call partial sleep seizures that don't even bring them to consciousness, but the seizures do destroy their sleep, so when they get up in the morning, they felt like they haven't had any sleep.
And I've heard of cases where people actually stop breathing when they're sleeping.
Absolutely.
And
well, sleep apnea.
That's sleep apnea.
That's sleep apnea.
That's sleep apnea, and that's another reason. A lot of folks with sleep apnea, interesting, men tend to manifest sleepiness, and women do, but more women tend to manifest insomnia as a result of their sleep apnea than men. And interesting, I just read a book that relates insomnia to sleep apnea because it's so common. And it's as if someone came into your bedroom and put a pillow over your face every 2 to 3 minutes, let's say, okay? And you weren't aware of it. You brushed the pillow away, and when you woke up, you just remembered I was choking. Well, that can lead to anxiety, and that can lead to insomnia because you become anxious about getting into your bedroom, but you don't know why.
You know, it's dangerous to sleep, isn't it? I don't think I'm going to go to sleep tonight.
We better stay awake all the time. The old adage, you know, the old thing is count the sheep. Does that work? I mean, should we focus on those kinds of things?
People with sleep onset insomnia, inability to fall asleep, I don't know about counting sheep, but we use things like guided imagery. We try that. We try meditation. We try progressive relaxation. All kinds of techniques we try. in order to get the person to relax their mind and their body. Because if you don't relax one without the other, you're not going to fall asleep.
Amazing.
It truly is.
I had no idea, but you know, there's so many studies out, and I'm sure you've been part of them,
Yes.
Dr. Rosenberg, about sleep.
We're making progress, aren't we?
And the effects, the detrimental effects of people not getting a good night's sleep.
Oh, absolutely. And it's really coming to the forefront now. You see it in the newspaper, you see it in Newsweek. I mean, people are becoming more aware of the fact that they need to sleep, and that they need to sleep at least 6 or 7 hours, I mean, on average. We have parents who bring children to us who, at the age of 3, the parent thinks that sleeping 8 hours is normal, and they want to know what's the problem with my child, and I tell them, well, at 3, they should be sleeping 14 hours.
Ah.
But they have the child on the same schedule they're on.
Really?
Well, working parents, you know, they go to bed, the kid goes to bed, they wake up.
Our children, okay,
Right.
brings us to a whole different topic, or another topic. Children are stressed in today's world. We see the stress reflecting in children's sleep habits, I would imagine.
We do. We do. I mean, they absorb a lot of the parental, what's going on in the house.
They're put under so much pressure today.
They are.
And
They are. And we see more bedwetting as a result. But we also see, we're also becoming more conscious of sleep disorders in children. A lot of children have sleep apnea and can be cured with tonsillectomies. A lot of children who have insomnia, we now have techniques to work with insomnia in children too.
how can they, oh, go ahead, Lou. No.
No, I'm just going to, a personal question. Do you sleep well?
I do. I do. Even before, maybe last night I couldn't. I was too excited about being on the show.
See, that's what I was saying.
But-
About the only time I really have a difficult time is when I'm very excited about something.
And that's normal.
Yeah.
I mean,
so
that is
a
normal.
lot of these things are normal. People may say, well, I have problems sleeping, but a lot of these are just normal
That's
patterns.
transient insomnia, and everybody has it. As a matter of fact, 30% of Americans in a recent survey had transient insomnia during the year.
How can we find you? Physical location?
Well, we're at the Sleep Disorder Center in Prescott Valley, and I'm there, and I have a nurse practitioner there. I also write a sleep column in the Courier, so if you have sleep questions, I would really appreciate people sending it in to askthesleepdoc.com. It appears every Sunday in the Vitality section, and that's the way I can get right to the community, even without them having to come and see me.
Well, great answers today.
Dr.
I know
Rosenberg, thank you.
You have helped our
Good information.
viewing audience today. Thank you. We want to have you back. There's lots more to talk about.
There is.
With sleep.
When we come back, we're going to talk about travel, but first...
But first, we're going to talk about traveling to a great place with the whole family and having a good time. But don't get too excited. You might not be able to sleep.
The Blazing M Ranch is the place. I know we're talking about staycations now instead of vacations, but if you want a short vacation and a fun one, check out the Blazing M Ranch. You can have some of Grandma Lou's famous homemade pies. You can learn to rope. You can learn to... I was going to say shoe horses. You can target shoot. You can do all the things right there on the banks of the Verde River.